Hi, welcome to AM Health Hub. Today, I have a special guest with me, Dr. Hisham Hakim. Doctor is a neurologist from American Spine Center. Welcome, Doctor, to the special show.
Thank you very much for inviting me to this nice show.
Most welcome, sir. Sir, I would like to, because this is a medical education for platform we are using, especially in the UAE, we are in a busy world.
Yes.
So many people are facing back pain, knee pain, joint pain kind of things, because
Correct.
most of them are working in front of the computer. Many are driving a lot. So my question is, first of all, we just go to the introduction of the hospital and about the doctor. Doctor, please just have a word about you and the hospital.
Well, thank you again very much. I'm Dr. Hakim, American Board Certified Neurologist. I'm specialized in the nervous system as well in the spine. We have the Center of American Spine Center at Dubai Healthcare City from 2011. In fact, our center started in 1991 in USA.
Okay.
And this is a branch of the USA.
Oh, great.
Our center specializes in treating spine and joint non-surgically. So we have a special technology that we're treating condition for a spine such as disc herniation or degenerative disc with very 360-degree protocol where we use special advanced technology that really help the patient to have long-term recovery plus no need for surgery. And that based on our specific 360-degree protocol, which I like to tell you more about it because really it's very sophisticated program.
Okay, great. So now we have an idea about the hospital and about you. The hospital is located in which part of Dubai, sir?
We are at Dubai Healthcare City,
Dubai
in
Healthcare
Building 64.
Building 64. Okay. So, sir, my next question is, as you say, even I have back pain, So people, even I don't like to do a surgery for me in this young age. Many people doesn't prefer to go for a surgery. So the specialization in this center is you do the cure the people non-surgically, right? You don't do the surgery, right?
Yes.
So can you explain me the procedure if a person is having a back pain? They don't know which hospital they want to go immediately because sometimes it is coming in the spine. So people are afraid, what to do.
Right.
So if you go to some other hospital, they will make us like too much fear. So please have a word with our audience,
Absolutely.
yeah,
Absolutely. Now we have, back pain is come from different sources. You have the back sprain, which kind of like maybe is musculoskeletal. That the minus one sometimes happen if you're bending the wrong way, lifting some weight the wrong way.
Lifting some weight, right?
Yeah, but that's kind of the small, mild case of back pain. That's sometimes few days go away. But the one we see really here, when we have patient have back pain with a disc herniation, what does that mean? The disc herniation is really, let me show you what does that mean. Disc here, basically the disc is two-part, is nucleus and annulus. Okay. And it is between the vertebrae. This is our joint. That's what make our spine move. Now, this is naturally have a lot of strength and power. Now, when we overpower this, we push too much on this, the gel, which is the nucleus, that can penetrate it and goes out, especially if we have sick disc. What that mean? If people are, for example, having problems with overweight, problem having a smoking habit, I'll explain more about this, very important.
So, smoking habits can also make problem here?
100%. And also, if they have a poor posture, they have deficiency in their vitamin D, that make the disc is weak. So if we push too much, whether we do it in our daily activity or can we do it in the gym, we see it very often, people who do this deadlift, those are really very dangerous. So what happens when you push too much, that material, which is gel, can penetrate the annulus and what's called disc herniation. And then we can see a picture like this. So what happened, that disc material goes out, pushing on the nerve next to it and cause this pain, which we call a sciatica or,
Sciatica,
and the ruptured disc, and that causing pain, numbness, tingling, weakness, spasm in the muscles. It depends about the intensity of the pressure on the nerve.
Okay.
So basically, this is the process that we see with our patient. So most of our patient really coming very disabled.
They can't walk even, yeah.
They cannot walk even in wheelchairs. They have weakness. So those are really typically our patient. Very advanced condition. They have been recommended to have surgery. So our protocol is very comprehensive. The most important things, one is to have a proper diagnosis. So after reviewing the images of the patient, after taking the history in detail, and the history we see to see their lifestyle.
Okay.
If they have problem with smoking, and smoking, what does it do, by the way? And to answer your question, and this is very important. All my patients, when I tell them smoking causes you back pain, they were like, "Wow, what is this?"
The cigarette is not much weight.
So what happened? The disc get nutrient from very small microcirculation, very minute blood vessels that go around the disc. Does not penetrate the disc, and through what's called vacuum mechanism, all the nutrients go inside in the natural way and the normal way. Now, in smoking, what happened? The disc will become dehydrated because those blood vessels start closing. Atherosclerosis, as we know, especially for people who have smoking for a long time. So the hydrating of the disc and the nutrient of the disc become deprived and decreased over time. So the disc become weaker, dehydrated, fragile. So over time, that become weak, and the person will do sometimes very minute things, sometimes just bending forward to pick up something on the floor. And because the disc is so fragile, when we push on it slightly, then the disc will completely go out. So that's what happened. But you add to the fact as well, the patient may be out of shape, maybe having weight issue. Vitamin D also weaken the disc and also weaken core muscle. So all those are make the disc is weaker over time. And when the right time coming in, then the disc will penetrate it because this start getting weaker and weaker and weaker. So any push on this will go through very easily. And we have a model we like to kind of show, and that is, we are pushing on the disc like this, sometimes from sitting wrong, putting load in here. Those blood vessels are closing because of the smoking. The vitamin D may be low, that make it weaker. And then we'll do just minor move. We'll find all of a sudden that this will go ahead and just went down.
Oh.
And push on the nerve here.
Just hitting the nerve, right?
Exactly right. And that giving the pain, the weakness, the numbness, the sciatica, all that symptoms are coming from this. And, will sometimes so severe, and sometimes the patient feel a pop, And sometimes the spine are so much tilted because of the contraction of the muscle. So basically, this is the underlying pathology that lead for this disc herniation. So it does not happen from the blue. It's really building up over time. And every time we take the history, we go a quick detail to see what really went wrong in the last, say, not 1 month, last years. When people sometimes do not sleep well, the poor habit, poor eating, lack nutrition, vitamin D, vitamin B12 deficiency, all those are predisposed to the acute injury that happened. So
great information. Yeah.
That's very important. That's very important for us to understand. Because that lead us how we treat the condition. Mm-hmm. So what we look when we identify the problem and we find the imaging test there, then we do the neurologic examination to see if they have weakness. That's very important. And if they have foot drop, for example, or weakness in the arm, if it is cervical disc, that will put us how we need to treat the patient. So when we put all this picture together, we have a protocol called 360-degree protocol. Number one, we need to decrease the inflammation happening from the disc here.
So that's the doctor said, if we have overpressure on our back, this backbone, this is a nerve. When we are having the more pressure, see the disc is bulging over here,
exactly.
Right? It is hitting the nerve. There we started the paining.
Exactly right. That's really what happened.
Okay. See?
It's very important to the patient to understand
what is happening.
What's happening. Then they can relate to the treatment. Yeah, I mean, most patients are like, I've never been explained this, but they are partnered with us to give them the treatment. And they need long-term course. It's not like something quick fix here.
Correct.
So basically, that's to explain it in a very layman language. Usually, the disc have negative pressure inside it, and the blood vessel come to the disc through negative pressure. All the nutrients go inside naturally through what we call absorption of vacuum mechanism. Now, what happened when the disc goes out? Then this material of the disc goes out and cause to have the disc to rupture outside and release the material which is inside the nucleus, which is half chemical but it's closed. When it leak out, give you more chemical inflammation. So it goes to have an acute inflammation to the disc and acute inflammation to the nerve. And then this inflammation become developed over short period of time, especially if it happened in acute stage, and start shooting down to the leg or to the arm and causing mechanical pressure as well as inflammatory pressure as well. So this is the basis of the patient's symptoms that we need to counteract. So the treatment that we start, we need to decrease this inflammation and we need to decrease the pressure on the nerve. So that will be the first step. And we do that, number one, through special type of injection or block that we use with it, stem cell therapy.
Yeah, for that I will come to your question. Okay, so sir, you explained that this is the symptoms that the patient is facing.
Yes.
So what are the advanced technology and the treatment method that you are implementing to be a cure for this kind of issues?
Yeah, very good question, because the important part of the treatment, it's really very holistic approach we call 360 degree. So the first arm of the treatment, one is we need to decrease the inflammation and decrease the pressure on the nerve, because we need to quickly improve the patient's symptoms and patient condition. So what we do, we need to do a special type of a block, nerve block. We use stem cell therapy in this, where we can not only decrease the inflammation, and also we repair the rupture, because this has become penetrated. So we need to remedy the rupture that of this material, and that's the annulus went out. So that would be step one for us. Step two, we use a special type of physical therapy called IDD therapy. And this IDD therapy is American technology. It does create negative interdiscal pressure that help the disc slowly to retract inside, and they'll help the disc to improve its vascularity and nutrition. So this need about probably 15-20 session of a treatment for this patient. Plus we guide the patient to do certain exercise they need to do. The problem we have, and on top of that, a lot of our patients have problem with posture. The posture problem is that we are sitting on the computer, we are sitting on the desk, and we are very much forward position. That will add more weight onto the disc on a chronic basis. So we need to reverse that to relieve the posture on the long term by doing certain exercise that we give the patient advice, and that's including exercise for the neck and exercise for the back. And that will be help the posture to improve. And what we say, you have to do this exercise 10 minutes in the morning, 10 minutes in the evening, every day for next 100 years only. It's a lifestyle things, and I can assure the patient, every patient really does this. After they get better, they will have long-term recovery, and they are so much better because they have flexibility of the spine, strength in their core muscle, plus they have agility, and they feel like light and have a lot of more energy. Simple exercise, you need to do it at home. People ask me to go in the gym. I said, go into the gym, but this is your base.
So prevention is better than cure. Everyone can start using this kind of approach.
Absolutely. Right? I've been doing it for almost 20 years now. Every single day, just in the morning for my shower, and really I'm get used to it. Just kind of get my body in order.
I just want to give you an advice to the kids. Can you show me this picture?
Absolutely.
In this picture, this posture, I am seeing it every day, including me and my children.
Yes.
When he's using the phone,
Agree.
Just see what advice you can give to the youngsters and the kids who is using nearly 5 to 6 hours of they are in the screen time using the mobile phones and in front of the laptops.
The unfortunate things, we cannot avoid anymore those tools. So we have to live with them in a proper way. That's very important. So we need, first of all, to let the children carry their phone not like this, like that. Okay, that's very important. That for the phone. That would be number one. Now, number two, if they are sitting on a desk and the computer on the desk, they need to have a proper sitting position. That's called the ergonomic, meaning your eyesight, your screen is a proper, not too high, not too low. Your desk proper, your chair is a proper. So this one, you have less load on your ergonomic of the body for the neck and for the back, and that's very important. Once doing the exercise that we mentioned will correct if it's something happened during the day. So this together really gets your body in order and get your condition improved. And as we mentioned, prevention is the best thing, especially for children. Unfortunately, now we see children in their, in 15 and 16 and 17 having problem with the neck and back.
Correct.
From this poor posture and poor lifestyle.
Yeah, this is a good message for all the children and the youngsters who is having a lot of screen time in front of the mobiles and laptops.
Absolutely. Other important thing is we talk about sleep. We call sleep hygiene. Sleep is really crucial. Remember, we spend about 6 to 7 hours in the bed, meaning we spend about 20 years of our life in the bed. So God put this stage in our day to detoxify our body. So we have to have good, proper quality sleep, where sleep is going to what called stages. And the stages go into stage 1, 2, 3, and REM, rapid eye movement. This is about 90 minutes cycle during your sleeping at nighttime. Now, if you don't go to the deep sleep, basically you do not have restful sleep. And what we usually do, we tend to sleep with our phone on. Number 2, we sleep after 12, 2 o'clock, 3 o'clock. That all will mess up your circadian rhythm, your biological clock. And when this happens, your body does not get adequate rest, does not get adequate muscle relaxation, because during night, with quality sleep, your muscle completely relax. And we detoxify all the chemicals, all the toxin that we develop during the day, we go and flush it at night time. For imagine 6 to 8 hours. All you have to do, close your eyes. God will take care of the rest for you. Get your cleans through your kidneys, get your liver, detox it, get your heart going and circulate. Everything, it have its own chemistry. So that's very important. So it's called sleep hygiene. And we talk about how we need to have good night's sleep. I have a lot of people, young and old, very disturbed sleep, especially in this time of age, especially in Dubai, 24/7. So it's really very, energetic life. And I can see it even from my son. He said that, I always tell him, you have to say good night before midnight. Don't stay after that. That's really important, And we recommend who have messed up their circadian rhythm to regulate that. We tell them, first of all, go to bed before 12 o'clock. Number 2, you need to sleep in the bed. Don't sleep on TV. Get away all those stimulants, your computer, your phone, all this. Number 3, sit in a cool room. Number 4, don't drink any stimulant, caffeine product, either coffee or Coke or chocolate or tea. Those are all will stimulate you, will affect your circadian rhythm. You can take milk or milk product because they have tryptophan. They make you sleep better. Remember when the mother breastfeed their child, after they breastfeed them, they have a lot of tryptophan. They go in deep sleep because of this. Now this is available in yogurt, milk, help you sleep.
So doctor, you said to avoid some kind of food products, caffeine before sleep. It will disturb the sleep. What are the items that you mentioned?
Basically, any caffeine rich product, as we know, coffee, tea, even green tea, by the way. People think that doesn't have a coffee, it does. Chocolate, all those are rich in caffeine that stimulate your system. So it really will inhibit your circadian rhythm. Then you have an issue having good deep sleep. It's very important to have deep sleep. A lot of people go into what called superficial sleep. Yes, they are eyes closed, yes, you are asleep, but you're not going to, stage 3 and REM, rapid eye movement. That's when you are in deep sleep, where you have the refreshing sleep, and that's when you see your dreams, by the way. That would be very important. And it's commonly we see have people insomnia, and people have sometimes sleep apnea too. Sleep apnea is really a problem, stop breathing at nighttime, especially people who have overweight issue. They tend to the back of the throat close. As the muscle relaxed, that muscle back of the throat relax as well, and then it close. Then the exchange of air, back and forth becomes stop. Then what happens? Your oxygen goes down, and your CO2 goes up. That wake you up. Then you wake up, not to level of you completely wake up. Then your muscle tone open up again, and then you go back to breathe. And that's what we call apnea period. Could be happening for 5 seconds, 10 seconds, sometimes 20 seconds, 30 seconds, and if it is too long, some people die in their sleep. Because what happened, that affect their heart rate, and they have arrhythmia. And then sometimes if they are susceptible for that, the arrhythmia will go haywire at nighttime, and they never wake up. That's very rare, but that's a potential risk. So that's why we have to recognize people who have, especially snoring. Snoring is part of sleep apnea. We do sleep study to see the architect of their sleep. Make sure it's a proper, it is having good cycle. They don't have those sleep apnea issue, because there is very simple treatment for sleep apnea. Okay. And people who have this what we call CPAP machine, they value this machine, how much really helpful to have good night's sleep. They wake up nicely and refreshed. Yes. That's important.
Thank you, doctor, for your wonderful time with us. So here we are winding up from AM Health Hub. So I believe that doctor gave a wonderful advices to everyone. Thank you so much.
AM Health Hub, your trusted healthcare partner.